Hi, welcome to KidzDocTalk with Dr. Jennie. Today's guest is Dr. Hanadys Ale, discussing the COVID vaccine in children. Dr. Ale is a pediatric immunologist and allergist at Joe DiMaggio Children's Hospital. She was part of the inaugural class at the FIU College of Medicine and graduated with honors in 2013. She then completed her pediatric residency at Miami Children's Hospital, as well as her allergy and immunology fellowship at the Nicholas Children's Cleveland Clinic, Florida Combined Allergy and Immunology Fellowship, and joined the Division of Allergy and Immunology at Joe DiMaggio Children's Hospital in August of 2018. She has published her work in medical journals such as Pediatrics in Review and the Journal of Allergy and Clinical Immunology Practice. She is also the immunologist and medical director of the 22Q Multidisciplinary Clinic at Joe DiMaggio Children's Hospital. Dr. Ale is a member of the Alpha National Medical Honor Society and was also the recipient of the FIU 2018 Torch Award as a distinguished alumna. Dr. Ale is a proud mommy of a 9-month-old boy named Alejandro, and she was breastfeeding when she received her own COVID-19 vaccine, which motivated her even more to keep strong on their breastfeeding journey since she knew she was passing her COVID antibodies to Alejandro through her breast milk. Welcome, Dr. Ale.
Welcome to KidzDocTalk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the Director of Telemedicine at Pediatric Associates.
Hi, welcome. Thank you so much for joining.
Thank you, Jennie. It's my pleasure to join too.
I'm so excited to talk about the COVID vaccine. I don't think we, have heard about this enough yet. I'm kidding. I think it's everywhere, but I think it's really important to talk about the vaccine when it comes to kids, because we got a lot of questions from patients and from families, and I'm sure you do as well, being an immunologist. So I'm really excited to get some insight. A common thing that we get asked a lot that I hear from patients is, why do we even need this for kids, right? This whole time we've been saying kids don't get as sick with COVID. Luckily, right, they've been spared from the majority of very serious side effects and hospitalization. So why do we even need to have this conversation when it comes to kids?
Yes. So as you said, as a pediatric immunologist, I get these questions asked all the time. I deal with questions about the COVID vaccine probably 3-4 times a day with different emails that I get from patients, phone calls, and patients in the clinic asking about this. And it is true that kids are less likely to get affected by the virus compared to adults, but they can obviously contract the virus and spread it to others. And even if they are asymptomatic, meaning if they may not show symptoms, that they can be carrying the virus and spreading around. Although there is also kids that get seriously sick, and we have seen this. We have seen it more than we would like to see it. Currently, we have children in our ICU that are very sick with COVID, unfortunately, and they can develop complications from the COVID virus. That require hospitalizations and also require intensive care and even intubation. So probably you have, I'm pretty sure you've heard, and probably our audience have heard about the multisystem inflammatory syndrome in children, also known as MIS-C, following the COVID-19 infection that has had a lot of negative consequences in children. So we have to be aware of that. And finally, in order to achieve herd immunity, and I wanted to kind of touch on the concept of herd immunity, this is a phenomenon that happens when enough of the population is immune to the virus to stop its spread. And in order to achieve herd immunity, everyone should be vaccinated, including our children.
So I think those are all really fantastic reasons. And I usually don't have a hard time convincing families that, right, there is a risk of the kid getting seriously sick. There's a risk of them passing it on to others. There's a risk of them having this right, multi-system sequela that we want to avoid. But then a lot of the pushback or hesitation that I see is, well, you know what, I get all that, but it's a new vaccine. Like, do we really even understand how it works? And how do we know that this type and mechanism of vaccine is actually safe?
Right. So there's a lot of things to say about that. I will start by explaining the mechanism of action of the vaccine, which the vaccines that are approved in the United States for children are the mRNA vaccines from Pfizer and Moderna. Their mechanism of action is actually based on a novel technology in which vaccines contain a special molecule, and that special molecule is called an mRNA transcript or messenger RNA transcript. That's what the M stands for, messenger. So this messenger RNA contains a set of instructions to manufacture the spike protein of the coronavirus in the recipient's body. The spike protein then generates an immune response and stimulate the person's immune system to make its own protective antibodies to fight the virus. The vaccine does not contain the virus itself, so there is zero chances from getting COVID-19 from the COVID-19 vaccine. Yes, a child can be feeling a little bit under the weather after getting the vaccine, but that doesn't mean that they have COVID-19 virus, but it means that they're experiencing normal side effects that happen when the immune system is working to launch a protective response against the virus. And then another thing that I want to touch on about this is a question that I get asked a lot is about, can this molecule get inserted in my child DNA and change the child's DNA? And I want to transmit some peace of mind to our audience about this molecule not inserting in the DNA at all. There is no way a messenger RNA can go back to the nucleus where the DNA lives and get into the DNA to change it. So that is the answer to that is no, it cannot change the DNA.
So I think that's a really critical piece of information, because those are two things that I think families hear about and worry about, right? Number one, can this change my child's DNA? And right, the answer is absolutely not. That's not how this works. And number two, can you get COVID from the COVID vaccine? And again, the answer is absolutely not. That's not how it works. So this is a really, I think it sounds like a really fantastic mechanism, right? And really a very safe mechanism for being able to deliver protection, right, against this virus. So you mentioned some kids do feel a little bit under the weather. So now let's talk side effects. What are common side effects that we should be thinking about, seeing, and kind of having on our radar?
Right. So the most common side effect of the vaccine is limited to pain in the injection site, but also can give you fatigue, some headaches, in cases chills and low-grade fever, muscle and joint pain. And this happens particularly after the second dose, when the immune system is working even harder to create these antibodies. So as I mentioned before, these side effects, what it means is the immune system is working, right? It's not that we are incubating the virus. In reality, we are not incubating any virus. Our immune system is actually working to process this mRNA, to create the spike proteins, and then the antibody, create the antibodies that the spike protein generates. I also want to talk about a side effect that we have seen. It is rare though, but it's the allergic reactions and even anaphylactic reactions, which are the severe allergic reactions. It is extremely rare. I have to tell you, Jenny, that I have many patients with food allergies, medication allergies, environmental allergies, a lot of different types of allergies, and none of my patients that have received the vaccine so far have had anaphylaxis to the vaccine. However, we do recommend, and we get phone calls about this a lot, we do recommend for patients that are allergic to stay for 30 minutes in the place where they receive the vaccine, and also to carry the epinephrine auto-injector with them in case of something happening.
Okay. I think that's really important to hear that, bring your EpiPen, but chances are that your reaction will not be truly anaphylactic, but certainly there's always a risk. So those are some common side effects. Let's talk about one that I've been hearing a lot about. I feel like there's new information daily. Even just today, I was reading even more about this as we learn more. Let's talk about myocarditis. I know it's reported. It seems that it's linked, but then maybe it's not linked. What is really happening?
Right, and you're totally right. I get information about the myocarditis that could be linked. As you said, we have not found a confirmed association just yet. And this is an inflammation on the heart that is seen or have been seen in patients that have received the mRNA vaccines, but only males so far. And the amount of patients are very small, or mostly males, I have to say. However, the extremely low occurrence of this side effect has led the CDC to continue recommending the patients to receive the vaccines. I did read today, I think today it came out in pediatrics. I don't know if it's the same one that you read. 17 children that they described in pediatrics. But if you look at those statistics, it's extremely rare, right?
And the one thing that I found reassuring from that report and from others that I've read is that the incidence, right, or the likelihood of getting myocarditis after the vaccine is actually lower than getting some of these complications that we know we see after COVID, like MIS-C, right, and possible other cardiac and pulmonary complications. So I think that's why we still feel strongly that despite this potential side effect, the risk of actually getting sick from COVID is much higher. So we still recommend the vaccine.
I totally agree with you.
So now let's talk about who should get the vaccine. Now that it's available to, kids 12 and up, are there certain patients, and certainly, in your patient population, you see kids who are allergic with asthma, right, who have all sort of chromosomal abnormalities and immunodeficiencies. Should we be prioritizing the vaccine to that patient population, or is it kind of, if you can get it, you should get it?
Well, because there are plenty of vaccines available, I don't think there is a need to make a priority list at this time. Every children that have the possibility of getting the vaccine should get it, or actually all children have the possibility to get the vaccine because it's out there and there's so many vaccines that they can get, and they should get it regardless of pre-existing conditions. Yes, we want we push the pre-existing conditions to actually get it, our asthmatic, our patients that are higher risk, but everybody can get the vaccine and they should get it.
So does that include patients who have already had COVID? Because we got a lot of questions of like, my kid already had COVID. It was, I don't know, last week, last month, 3 months ago. And should those kids still be offered the COVID vaccine, or is there a time period that they're supposed to be waiting?
No, these kids can, and actually it's recommended for them to get the vaccine. It is true that the body has some antibody protections from COVID after being infected. Those are natural antibodies that you get when you're exposed to the virus. But we actually don't know for how long an antibody will last, but we do not know from research that it should last. Protection from the vaccine should last approximately 6 from 9 months and possibly longer. Studies are still undergoing about that. So a vaccine is the only certain way to give you lasting, durable immunity, and that can even be boosted with repeated vaccinations. So vaccine, and I also want to say, is that they can give you protection against the newer variants. The vaccines, not the virus.
So I think that's really important, right? Because I feel like a big pushback, or again, not pushback, but just hesitation that people have is to say, I already had COVID. My kid already had COVID. We have antibodies, right? We already had it. That's the big one. And
oh my God, I get that all the time.
Right.
All the time.
Right. So whenever I ask, like, is so-and-so vaccinated, like, trying to find out people's vaccine status before deciding if, I'm okay interacting with them. Obviously my kids aren't vaccinated yet. I find that that's an answer. And I always want to say that means nothing, right? Like, we don't know what those antibodies protect against. We don't know how long they're around for, how much of protection they offer, against the newer variants. And like you said, the only concrete way that we have of knowing that somebody is protected and we're monitoring and studying for how long that protection actually exists is the vaccine.
Exactly.
So I know you have a cute little baby at home. I have little kids at home. I'm sure you're anxious to get your child vaccinated. What's next? What do you see happening in terms of like age cutoffs for the vaccine?
So it's exciting what's happening. There are clinical trials for both Pfizer and Moderna already underway in children as young as 6 months. So my baby Alejandro will be will be eligible to get the vaccine as soon as it comes out, and I am excited for that. So, but we will be learning more in the next few months.
Okay, fantastic. I'm really anxious to get my kids vaccinated. I always make a joke that if I could make a fake ID for my 9-year-old,
oh my God.
if she could pass for 12.
I have to tell you something about that. I did get I got vaccinated in January in the first group of doctors that our institution got vaccines for. And one of the things that actually made me excited about this vaccine was not only to get it for myself, but also because I was breastfeeding Alejandro, is to pass it on through my antibodies through my breast milk for him. So he might have some antibodies from this breast milk that I'm giving.
That's really exciting. I'm following those studies closely. I know they're sort of investigating the effect it has, but we make a strong recommendation for breastfeeding and obviously for pregnant mommies as well, to get the vaccine and to be able to offer that protection to the babies. So talking about the vaccine and talking about little kids, is the dose the same? Is it a smaller dose than the adults get, or is it kind of the same thing for everyone?
No, it's the exact same dose for children and adults. So no, it's not smaller for the children.
Okay. And finally, we're having obviously a lot of teenagers who are thankfully getting the vaccine, but we also need to vaccinate them against other things. We need to give them their meningitis and their other boosters. So I know initially there was a period of time where we had to wait and space those out. What is the current recommendation in terms of timing other vaccines against COVID?
So the good news is that the COVID vaccine can be given at the same time as other vaccines or shortly before or after. So there's no need to have a waiting period or anything like that. And especially now, because of the pandemic, our kids have gotten behind on their vaccination schedule. So there's no need to fall even behind due to the COVID vaccine.
Yes, we're definitely seeing huge gaps in well care and huge gaps in keeping kids up to date on their vaccines. So I'm excited to say that there's no need to wait. Get your COVID shot, come in, get your meningitis shot, get your boosters. We can
awesome.
take care of all of that. So that's all great news. So this has been hugely informative. I'm so excited we got to chat. Any main takeaways, anything that you really want to make sure that parents and us as general pediatricians kind of walk away from this conversation feeling good about?
Yes, Jenny. So I would say that my main take-home message from our conversation today would be that I, as a pediatric immunologist, who has been following all the research about this vaccine extremely closely, I highly recommend parents to give the vaccine to their kids 12-year-old and older, and to their younger kids when it's available for these a younger age group. The higher the percentage that get vaccinated, Jenny, the less COVID-19 is going to play a role in our lives in the future. Yes, probably it's going to still be around, like the flu or other viruses, but we won't be seeing a global pandemic like we're suffering right now, and we won't be seeing like these surges and spikes that we have experienced. And then obviously, again, going back to the concept of herd immunity, if the children are vaccinated, then we'll be closer to achieve herd immunity. And again, it's when enough of the population is immune to the virus to stop its spread.
Fantastic. Thank you so much. I have loved this conversation. I'm so excited to get to share it with everybody. And thanks again for joining.
Thank you, Jenny. It has been an honor and a pleasure to join you for this COVID-19 vaccine conversation.
Thank you.